Just a minute.
This call is now being recorded.
Yes, ma'am. Yes, ma'am. We can begin.
Yes, doctors, dear doctors, good evening, very good evening. So I think introduction की जरूरत नहीं है and iconic platform. So people will be joining and joining. So I need to admit them, right? So the link is the same old link, huh? Okay. So ये बीच बीच में admit करना ही पड़ेगा. Okay, so where is this one? So did you all remember, as this is a continuation session, so first of all, we will remember about our iconic group. So where we are today on this platform. So I really very thankful to this platform because I am able to expose to so much of homeopathy and so much of homeopathy from women. So this was my target since my since 10 to 15 years back also. So I'm working with women homeopaths. All of free service I'm doing since 10 years. So training them and improving their confidence levels and seeing them to flourish in their practices, something like that. So now, chalte with our journey, we are here today on this platform. Okay. So and iconic platform is really a very good selfless working platform for women. So generally give much support to this platform. Okay. Add more people and give much support to this platform. So as we go to our session today, so I'm Dr. V. Padmaja. So for the people who have joined for the first time, I'm telling you. So I'm Dr. V. Padmaja. So I finished my BHMS 30 years before, and this is the 30th year month, June. So June 6th, I have finished my degree registration also. So I started practicing since then in Hyderabad. So I finished my FCAH, that is faculty course of advanced homeopathy from Ashik University also. That is Dr. Rajan Shankaran's teachings. That depends on that one. And also I have finished some modules of homeopathy and also the mind method. So and also the Hahnemann's regular Bower Boning Hassan method. So I will be seeing in the patient and deciding about the method first, what method should be given to which patient, then only I'll follow accordingly like that. So that is why my cases will be in mixed languages, like sometimes symptom approach will be there, sometimes there will be a system approach will be there, like that. Okay. So last week's recap we will see. Second, let me start this. Yes. So am I audible and visible? Just please confirm one time. I think I'm audible and visible also, right? Can anyone confirm whether I'm audible or visible?
Yes, ma'am. You're audible and you're visible.
Yes. Yes, thank you. Thank you so much, Rachana. So this is me, Dr. V. Padmaja Rao. So I'm a consultant at Shanti Homeo Stores at Hyderabad, and I have my own practice in the morning. That is Dr. Padmaja's Homeopathy. And I'm presently working as mentor in Iconic Group, this platform, the same platform also. So this is my intro, and this is the topic. Just a recap. I won't go very deep into it. Last week we have seen this. This is for the beginners today. Okay. Last week we have seen this. The normal uterus, the adenomyosis uterus, and the endometriosis uterus, because we are discussing about adenomyosis versus endometriosis. And last week we have finished, in the first part, we have finished all the pathology, all the homeopathic perspective, and also some cases. So since the time is very short last time became short with all our interactions. So today also we have been continuing with the remaining cases. Okay. So this is the adenomyosis uterus, where the endometrium is clear And the myometrium is also having some endometrial glands here. The myometrium is invaded with endometrium type of glands. So these are the fallopian tubes here. These are the ovaries. This narrow part is the cervix, and this is the vagina. And this is the adenomyosis uterus. While coming to the endometriosis uterus, the endometrial lining is also very normal. So myometrium also we are having some spots outside the uterus cavity. Spots outside the uterus cavity is the characteristic symptom of endometriosis. So when these spots are also, these are the tissues similar to endometrium. When these are also discharging, bleeding, like in the time of menstruation, and this bleeding is does not have any way to come outside the vagina, through the vagina. So it will cause inflammation, it will cause adhesions, and it will cause what not, everything, and infertility, dyspareunia, and everything. So this much we have learned, and you see clinical variation for differentiation for both of them. This is just all recap. That's why I'm going so fast. If at all, if anybody is having any doubt, you can stop me and you can ask every time. So don't close the session with doubts in your mind. That is my request. Okay. So in adenomyosis, endometriosis, if we compare, means adenomyosis generally location is inside the uterine muscle, that is the myometrium, and endometriosis, it is outside the uterine cavity. So age doesn't matter. Uterus is in scanning, uterus will be enlarged and boggy uterus in adenomyosis, while it could be normal in endometriosis. Then the bleeding is very heavy menstrual bleeding, and here bleeding, it may be in the during the menses less prominent, but outside the menses, like irrespective of menstrual dates, the bleeding may be shown, seen in endometriosis. And the pain is a diffuse uterine cramps will be there, very sharp pelvic pains will be there in endometriosis. And infertility is possible, here it is very common. And dyspareunia less marked, here more marked, pelvic nodules absent and pelvic nodules present. And pain timings is, pain would be during periods only, during in adenomyosis, but before and during periods and after periods, irrespective of the periods, pain will be there. Then we can suspect of endometriosis. Then imaging is thickened myometrium will be there in scans, then where we can think about adenomyosis. And ovarian cysts or endometriomas or chocolate cysts or adhesions are seen in endometriosis scans. Okay, so the systemic symptoms also will be varying. In adenomyosis, we don't have that much of a systemic complaint, but in endometriosis, the bowels are also disturbed, the bladder is also disturbed, and pain in during menses will be there while she is urinating also, while she is passing stools also. That is the symptoms of endometriosis. Okay, these are commonly seen in homeopathic remedies. We have taken one-liners for them. For sepia, it's a bearing down sensation, irritability, hormonal complaints, and lachesis, it is left-sided symptoms. Congestion should be there, intolerance of tight clothes. These are the PQRS symptoms of these remedies. So if these symptoms are seen, we can directly think about these remedies. So that is why I have kept all them in one-liner. So Sabina, profuse bleeding with clots, thalapsy, excessive uterine hemorrhage. Difference of both of these is thalapsy is excessive. That means it runs from period to period. Menses to menses, it will, the discharge will be seen. Continuously, pura mahina discharge ho jayegi. So that is the difference between thalapsy and sabina. Belladonna, acute congestion and throbbing pain will be there. It is very acute. Congestion is more important than the, congestion and pain is more important than the discharge. Calcarea carp, obesity is seen compulsorily, profuse menses and fatigue. In some syphilitic cases of calcarea, obesity may not be seen. The patient may be very thin in calcarea iode cases also, but by and large, obesity is seen. In murex, pelvic soreness with heightened sensitivity will be there. Murex is also bearing down sensation will be there, but in general, first grade, second grade, third grade prolapse also we can see in murex. So we have already discussed the case one, that is a 21 years girl. So she is explaining about heavy, highest pain of dysmenorrhea, and highest complaint of dysmenorrhea, rolling down on the floor. And but one particular symptom you have noted is during the pain, she is complaining to parents that you are not taking care of me. And after that, appetite is decreased during menses. These are the points we have taken in that case. And she has the sibling rivalry. So this is the before scan showing adenomyosis. Remedy given was lactaninum 200 because of the, with the sensation approach. Okay, we have already discussed this very extensively, so I'm going through very fast. Okay, And this is after the scan, there is no sonological abnormality, and this is latest scan, March 2026. After 2 years also, she does not have any complaint. And this is case 2. This also we have finished. There is a 43 years lady, acute pain during menses, and also she is having one 18 years child, and she is worried about the secondary infertility. And since after first pregnancy, she is having adenomyosis and fibroids and whatnot. But even then, the doctor said to advise it to go for hysterectomy, but she didn't opted for hysterectomy. She wanted a second child. She has taken 3 years of allopathic treatment of hormones, and then she conceived and she got a male baby, male child. So that after 18 years of his first child, okay, and still she is having extensive adenomyosis. Even in adenomyosis, she conceived and she got the child. And after that, also fibroids are very much an extensive adenomyosis and chronic anemia. But her symptom is, I want a family, one person for my elder son to companion like that. And she has the shopping mania. So she wants that she needs to be superior in amongst her own relatives. Then one time she got that right lumbar pain, right sided pain, heavy shopping mania, always want to buy more for her children, and not a chilly patient. So I noticed we have prescribed here. We did not go with sensation method or any system approach. Here we have taken the concomitant, and here we have taken the PQRS. Like she says, her abdomen is bloated with easy satiety during her pregnancies, miscarriages, and also regular menses, and also the shopping mania becoming superior, and also the right-sided complaints. And she has a hemangioma in the right lobe of the liver, and gallbladder polyp is there, bulky uterus is there, extensive adenomyosis, and extensive, very, very big fibroids are there. Left kidney angiomyolipoma is there. This is our first scan with me. Then we have given lycopodium on that issue, and then lycopodium. See, I'm going little fast because all these are discussed only. So when I come to the new case, I will stop and I will be slow. Okay, please don't mind for that. Or if you feel that I'm little fast, please let me know. I will go a bit slow. Okay. And what is that, Rachana? Is it okay? So that I have covering the old cases like this?
Yes, it's okay, ma'am. We can
Yes,
continue
yes,
this.
yes. Thank you. So in this after lycopodium, the adenomyosis became diffuse. The next scan is diffuse adenomyosis, and significantly it decreased the adenomyosis. The fibroid is also decreased half in its size, and then the next scan have been kept on placebo and thiocinaminum and ferromet supplements, and her cycles have become regular from 45 days to 28 days, from 10 days discharge to 4 days discharge, and the pain has completely decreased. And still she is on medication. After that, her adenomyosis only slightly presented, attached to posterior wall. Fibroid became 8 millimeters from 30 millimeters. And then the follow-up, one fine day, she got that acute pain, right leg and right knee again. So one more dose of lycopodium 200 repeated. And now there is no adenomyosis in the latest scan. And the fibroid is also only seedling fibroid, that is 4 mm. No hemangioma, no gallbladder polyp, and the kidneys are also normal. So completely normal. After that, she didn't visited me. I think she is completely fine. And this is case 3. Here we are last time. So of course, I have explained one more out of the box case that I will tell you. But here, this case is all for you. Okay. So be ready for the interaction. This is a very small case. In the sense, I have understood it is in within 10 to 15 minutes in my clinic, because of the learning of kingdoms. Okay, again, this is the learning of kingdoms. See, I will read the case. A patient in her late 40s came to me in 2022 with acute dysmenorrhea, pain driving her to cry, and she can't control herself. Okay, she is very depressed and always says that her husband, mother-in-law are not at all good with her, and no appreciation at all, even after working very hard. And when my sister-in-law comes, these people will make jokes of me and my unskillfulness. This is what her uh, complaint is. Then slowly my children are behaving like that. I am not wanted by anyone. Death may be my relief. So that is what is a suicidal tendency also. I am not wanted by anyone. Death may be my relief. So the death means she doesn't want to commit suicide. But here what? Even only by death, this type of uh, pain will be coming down only with death. That is the heightened pain she is expressing. Okay. Then what? Then nobody have seen the remedy, right? So this much of case I got. In my clinic, I don't have much time to spend with patients because I need to see at least 20 to 30 patients in the span of 2 to 3 hours time. So sometimes I may give only 10 to 15 minutes for even the new case also. So I need to be so sharp in picking up of the remedies. So this much of case I got. Hmm? So a lady with acute dysmenorrhea, she is crying and she says that she has not been appreciated, and so death only would be the relief for me, solution for my pain. So that is what she is telling, and she is crying in front of me in the clinic. She looks little decent, but she is crying. Okay. So those who are learning kingdoms with me, can you spot which kingdom is this, or can you directly tell me the remedy also? Because that is her constitutional remedy and no other remedy is necessary till date for her. Okay. Anybody, you can unmute yourself and let me know very fastly. Otherwise, we may be spending more time like last time. So anyone for the third case. So third case is we have not done last week, so I'm taking time for that. So unmute your mics and let me know what kingdom is this, because I have selected kingdom approach for this case. So that much of case I got. So what is the kingdom? Can anyone tell me? Or what is the remedy? What is your understanding? Yes, make it fast. Or otherwise, no chatting, just directly unmute your mics and let me know your understanding and the kingdom, because seeing the chat and discussing it may take some time. So, okay.
She could
Otherwise,
be
I will.
animal, madam.
Why?
She's blaming others only now. She's not complaining about herself, but family members she's blaming.
Yes. Very good, Ragini. That is the basic understanding we need to have. So, why nobody is answering like this? So, you have already finished the kingdom webinars and understandings, right? So, you need to point out, you need to be very sharp, okay? You need to be very sharp by letting me know about the kingdom. Okay, you have got the kingdom. So, what could be the remedy then? And that is very simple, right? I have already discussed about this remedy. Yes. Anyone? Anyone? Okay, so this is the remedy given. Lacaninum 200, which completely cured her from inside, and later she received Lacaninum 1M. I think from 2022 to 26, I have not given any other medicine for her. She had seen me only 2 to 3 times, because for the first time only I made her educate what is happening within her, and I have given Lacaninum 200. After Lacaninum, she was the happiest woman. She is for her children also. Recently, she came to me in 2026, last two months back, not for herself but for her children who are studying in +2 now. So she is a very confident, smiling, beautiful, commanding person. See, all these are very important. Earlier, she used to cry. She is not that much confident. Now she is smiling. She is confident. She is beautiful. Beautiful in the sense, kajal lagana, achhi tarah, bindi lagana. She is very, very mindful in her attire now. Okay. And she is a commanding person. She is speaking in a commanding tone with her husband now. Now she is not at all worried about family, husband, or something like that. Okay, she's a commanding person and came along with her husband only. That is what is the guts she has shown upon after lac caninum. Otherwise, she used to be very afraid to speak about, to take the name of her husband also. Okay, so that is about lac caninum. Got it? So in this case, we have given the constitutional remedy and the acute remedy, both are same. And lacanum has been given during the pain and during the discharge only. So I have not spared it to give sometime after the like first I will give some pain remedies like Magfos, Colusin, China, root or something like that I'll give, and after that I'll keep lacanum as a constitutional. No, it did not happen in this case. In this case, lacanum has been given directly during the menstrual period and during the pain only, and she received 200 lacanum, 3 to 4 doses in a span of 6 months. And after that, after 1 year, when she came again, that I am having slight that symptom. By this time, she had been educated that what is happening in her mind. So whenever she had pointed her to be depressive little slightly, she came to me running. Madam, you have given some medicine and that is proving upon me. Please give me that medicine in higher doses because I am getting little depression now also. Then I immediately gave her 1 m, like an NM 1 m. That is only 2 to 3 doses, I suppose, in a span of 3 months. That's all. And never, nothing more she received. So that is as simple as like that when we learn about kingdom's approach. And this case has taken only 5 to 10 minutes for me. But she is suffering since 10 years. She is suffering more than 10 years. She is suffering like that. And she got to the scans and everything since 4 years. Like that. So she went to the gynec, and when the gynec had told that to go for hysterectomy, then only they will come running to us like that. Okay. This is about the constitutional method. And now this case 4. This is a very different case. So this may take some time for us. So be keen listening to this case. So as we know that all cases will not be as a cakewalk, right? So this case really very long since 2022 and still going on with me. And I have selected the symptomatic approach here because I could not get any such things. She is deeply psychotic in nature, like so many complaints, and even then she smiles every time. She has that acute dysmenoric pain. Itna pain hai she can't control. In that pain she cries, but even then after that and before that also she smiles. She's a smiling person, but that smile means that is generally like that. She's generally a happy going woman like that. And adenomyosis. Here, she has adenomyosis and also fibroids. So adenomyosis is decreasing and fibroids have increased after my treatment. But later, all the fibroids are also decreased. So here we need to know which disease should be decreased first, which disease should be decreased later, which symptoms, not disease, okay? So fibroids should decrease later because they are more psychotic. Adenomyosis is psychosyphilitic, so it should come down first. That is the right way of curing, okay? So what happened in this case? So she came to, this was a very long case, so I did not write all the case, so I will be reading from the directly the case sheets, okay? So she came to me with this constipation. She did not come for acute dysmenorrhea in the first place. She came for constipation. The stools are very hard. She can't pass stools during periods, okay? So then the periods issue has come down. So she has already taken from another homeopath, and they did not mention about anything about the periods. So they have just given medicine for the constipation, and again she came to me and she's explaining about constipation and bowel movements and everything. Till 3-4 visits she expressed only that one. After 4th visit she told that even after inquiring about periods also, okay, she's telling. She does not want to reveal about her periods because that much of psychotic nature she is. She is worried about her constipation during periods. That means it could be an endometriosis case also, but fortunately this is an adenomyosis case and fibroids case only. So then after 4th visit, she told that my periods are very early and very extensive pain will be there during periods. Pain in abdomen extremities also will be there. So, and I have given some pain remedies in the beginning, like Magfos, Colocin, but helping. And then again, I have given, then again, she's highly bleeding and she became anemic, completely anemic. Hemoglobin went up to 4, as down as 4. So I've given China in that time. So China in higher potencies. So it had helped a little bit. Her hemoglobin raised to 6 or 7. That's all. And discharge also has decreased it from 10 days to 4 days. So, but that's all. The China did not help more. So then I kept on placebo, and then after one fine day she came with acidity, chest pain. So she is explaining about the bowel movements, dysfunctioning of bowel movements, and also the chest pain, the acidity, and bar she is explaining that only. Okay. Then she received some pain remedies for her spondylitis, for her arthritis, like Rustox, as simple remedies as Rustox, Vigilia, something like that. And I have kept her on for 6x, and we are having Kurshi mother tincture for her bowel movements. So some patents are being running, and some remedies are also being given, but each remedy is working with her, but not permanently showing results. So then I made her take the first scan, that is in 2022, before coming back, just when she came to me. That is uterine fibroids are there, evidence of well-defined heterogeneously conic lesion, that is anterior myometrium, that is intramural fibroid. So in the first time, they said it could be focal adenomyosis also. It may be fibroid or it may be adenomyosis also. That means it's not clear at that time. Then again, after so many remedies in November 2024, so that is also the same focal adenomyosis. I think the same scan has been repeated. So this is November 2025. The earlier scan is same scan. So November 2025 was the second scan after all my medication. So what happened? Bulky uterus with diffuse coarse myometrium and focal coarse hypoepic area, anterior wall, suggested diffuse adenomyosis. बहुत बहुत ज्यादा एडिनोमाइसिस था. अब तो क्या है, वेरी डिफ्यूज एडिनोमाइसिस, बट यूटेन फाइब्रॉइड्स आर लाइक दैट ओनली. 4 fibroids, very big fibroids are there in the 4 directions of the uterus. Okay, then क्या हो गया, और कुछ remedies हो गए. So I have ventured with this lycopodium. So lycopodium is good. It did work well with her, but it also did not completely work. So then I have made her to go with, because she is continuously telling about the digestive symptoms during periods and the dysfunction of motion symptoms. So bowel symptoms are not good. So I have made her to go through the cycle of sulfur, calcarea, and lipo. Okay. So after sulfur, calcarea, and lipo, and she's doing little bit better, and all her complaints have come into 50% decrease. Now she has been spacing in between also. She's not been regularly coming also, because she's feeling better. And after that, again the condition repeated. Then I thought that, so okay, she is having so much of psychosis. So I have given intercurrent remedy, that is Tuja Varnam. After Tuja Varnam, so I have repeated this calcarea cycle one more time after Tuja. So sulfur calcarea lipo, before Tuja, it has worked only 50%. After Tuja, it has worked about 75%. That is what is about the intercurrent remedy. Okay. So then after intercurrent remedy, so this is the recent scan. This is I have given so many visits she have come, but in between only placebo is being given. But sulfur calcarea lipo. So 1 month I will be giving sulfur. On the next month I will be giving calcarea. On the next month I will be giving lycopodium, like that, spacing of remedies. And in between, if at all she is having much pain, then I will be giving about some painkillers like Magfos, Colocin, Thalapsy. She received Thalapsy, China 1M, Protelas for the discharge, Thiociniminum 6x regularly. So Pelvorin is the white discharge one, some patent for white discharge, something like that they've been receiving. And this is the final scan in March 2026. So you can see that adenomyosis of uterus is only now, one second, latest scan. I will read this in February 2026. The scan report, you have seen this now. So it reads like this: bulky uterus with coarse ecotexture of myometrium. Consider the possibility of adenomyosis only. It's only the possibility. It's not focal, it's not diffuse, it's not complete adenomyosis. It consider the possibility of adenomyosis, and fibroid is becoming 34 to 41, and cyst in the right ovary. So That means ovaries also cysts are seen. That means the psychosis is being shifted. The syphilitic miasm has decreased. Adenomyosis has been decreased, and it is going into the psychotic. Now, after this, the psychotic also will come down. So this is a case of adenomyosis. It really went very long, very. But what's the learning from this case? Intercurrent remedy proved very happily, very good in this case. In this case, the Thuja 1M, and before the intercurrent remedy, the same remedy is being repeated after the intercurrent anti-miasmatic Thuja remedy, and that is worked very well after the blocks have been cleared. Okay. Yes, Rachita. You can unmute
Ma'am,
it. Yes,
good
yes.
evening, ma'am.
Yeah, good evening,
Ma'am, before
Rachita.
adding the intercurrent remedy, you have given sulfur calcarea and lyco, right, ma'am? Other than
Yes,
acute, constitutionally, you have
yes,
prescribed that, ma'am.
yes, yes.
What made you to choose that cycle, ma'am? Is there any indication regarding
That is
one
what
remedy
is.
or?
So that is what is I have told. Na, bloating is there, gas problem is there, epigastric pain is there, and her bowels are her abdomen is completely distended. So in this, Hahnemann's trio is sulfur, calcarea, lyco, or lyco, sulfur, calcarea. Anyhow, anywhere we can see. Lyco is for the lower abdomen complete bloating will be there, and then it will be generally the acidity will be going towards the upper side. Na? Chest pain, burning will be there. So next visit they will take sulfur, and that burning also will be decreased. On the next visit they will be taking calcarea. That will finish the case. This is Hahnemann's understanding about uh, bowel disturbances and gases, and whenever, even though without periods also, like that. This is Hahnemann's trio for bowel disturbances, gases, flatulence, distension abdomen, like that. Okay. One more classification is also there, like Corbovez, China, and Lycopodium, that you already know. That Corbovez, China, and Lycopodium means Corbovez is for upper abdomen, and Lycopodium is for the lower abdomen, and China is for whole abdomen, right? We all know this. We have studied in first year VHMS only, right? So when the gases are disturbed, when the flatus is disturbed in the upper abdomen, that means if she is very much better while she is belching than passing flatulence, then you can choose Carbovage. Even Carbovage is very good for flatulence, very good for passing flatus also. And but anyway, you can choose Carbovage for upper abdomen, like epigastric pain and gas bubble being here, and she's mimicking about some cardiac symptoms, like she's mimicking, and she gets very tensed up. In that way, Carbovate, if you give one dose, means she will just sit up like anything. And if the same complaints are in the lower abdomen, then we will prefer Lycopodium. Distension of abdomen is very much seen in Lycopodium. And if these symptoms are seen in complete abdomen, lower, upper, higher, lower, and in the middle also, then we will prefer China. So that is about the Materia Medica proving of Dr. Hahnemann. Okay, got it? Got it, Rachita? Shall we move on? Thank you. So this is a case where we have understood that symptomatic approach is also we can do. So not in all cases we'll be going into system approach. Maybe if I have stressed myself more, I may have selected some other remedy by system approach also in this case. But as I have told you that I will not be spared with such time schedules in my clinic. So I need to go for the easiest way. Like, so I have taken the symptomatic way, and now after 3-4 years, but remember, after each prescription she is improving. After each prescription she is good. She is not telling that I'm not good, what are you, what is the medicine you are giving? No, nothing like that. After each prescription, some part of her will be happy, like that. So that is what is called removing of psychotic layers first. Okay. Then after intercurrent remedy, the same medicine, the same cycle worked very well. And now she is in this position, completely close to normal. So that is about case number 4. Any doubts on case number 4? Shall we move on? Are you able to get all of you? Please show some thumbs ups or something so that I can
Yes, ma'am.
understand. Yes, yeah, that's so fine. That's so fine. Because no, so I feel that I am going little dryly, not like this. Na, Padmaja session will be very interactive, right? So now I will make you interact also. Don't worry. Mm. So this is the fifth case, out of the box case. Anyone remember this case? So this is I have already told this out of the box. Last week only we have discussed about this case. Anyone remember about this case? Anyone can unmute and let me know. Make it fast. It's already 9:40. We will take 10 to 15 minutes more. That's all. Let me know. Case number 5, I said it is an out of the box question, out of the box case. So where we have seen a 16-year-old girl who did not attain menarche. If at all you are not interactive, I will call your names. Then that particular doctor should answer, right? I don't feel good if there is no interaction. Okay. So Dr. Jayanti, I think you have appeared for the last session, right? Did you appear? Are you there in the
No,
last
no,
session?
ma'am. No, ma'am.
Okay.
No, ma'am.
Okay,
Yeah.
okay. Then I can spare you. Yes, Sunita, it's sulfur case, but what is the case actually? You can unmute and you can let me know, Dr. Sunita. So anybody trying? Okay. So a 16-year-old girl. Yes, please.
Who has not attained menarche, and it's
Mhm.
very rarely we see this adenomyosis in this case. Basically, sulfur was given because of to open up the case, and also she had some
A
family
symptom
con
that she doesn't want to bath every day.
every day. Yes,
Right? But doesn't want to take bath daily and she feels bad to take bath daily, but no
yes,
hydrophobia as such. Yeah. So
yes.
to open the case, I have given sulfur 1 name. But what happened? She had attained menarche in only just 20 days, 20 or 19 days after the treatment. Okay. So that is out of the box case. Why is it become out of the box? Since till now we are thinking that adenomyosis will be coming in the reproductive age only, and we have seen 21 years case also, and we have seen 43 years case also, 43 years women case also we have seen, and at the equally we have seen 21 years girl case, lady case also. But now it is 16 years girl who have not attained menarche. So she has been suspected adenomyosis by the gynec, and so they have come. She suggested hormonal treatment. So to be safe, they have come to the homeopath, and now this is the case with her. She is very happy now. Okay. Now this is the case 6. This is very a new case for us. So I will read out the case. You let me know. In 2019, I had a case of pain left hypochondrium in a 35-year-old female, constantly prolonged by the gynec, saying it could be an ovarian cyst. So why I selected this case means sometimes why we are delayed in these cases of endometriosis or adenomyosis, the diagnosis also will not be very proper. The scanning, the diagnosis centers also will not be proper, and the reading of that images also will not be proper by the gynecs. It would be confusing. It's not the mistake of the gynecs. It would be confusing. So the gynec had said that this woman is saying about pain in the left hypochondrium during periods and before and after periods also. The gynec is saying that maybe it's an ovarian cyst. Take it light, it will go. And she is giving some hormones, estrogen, progesterone, something like that. And it's being prolonged constantly. Then sometimes diagnostic labs also should be perfect. Okay. After 5 months, so she is prolonged that pain for 5 months. She suffered that pain for 5 months. She came to me after 5 months. That lady has selected homeopathy and she came to me. And very first beginning only, she came to me with very acute pain. Now by this time, after 5 months, she naturally became depressed with that pain. So very acute pain leading to depression, and she is accompanied by her husband. So always you need to see who is accompanying her. That will also give some good answers to us, whether mother is coming, child is coming, husband is coming, and how she is behaving with their family members. Okay. She has accompanied, generally like these cases, husband won't come now. So her mother or mother-in-law, sister-in-law, friends will come. Husband generally, even though they come also, they will sit outside. But here she is accompanied by her husband. That is the main important observation I have taken. So why it would be main, you will be knowing. She is continuously complaining about him in his presence only. She says that I would have not gone into the stage of you, into the stage if you have shown little concern to me. It is your duty, right, to return my love, at least to reciprocate my love. Okay, this much of then she is telling. What she is telling, she is complaining about her husband that that is it is his fault that she has landed in this painful situation now. Because what is his fault? He did not taken much care of her. That is what is her complaint. And she says that I have been loving you, but you should have at least reciprocated my love. That is what is her complaint. So now, can you get the case? Can you get why I have said that the accompanying person is also very important? Why the husband's presence is very important in this case? Can you guess now? Can you guess the remedy? Can you guess the remedy? It's a very easy prescription. So she is complaining the husband, all the kingdom learning people, I would not spare you like this. So what she is telling actually, she is complaining. Yes, Dr. Sunita, it is natramur only. But what is your understand? Why would you say it is natramur? Who is this? Roll number 363? Uh-huh. It's a very, who is this doctor? Just now joined in the name of roll number 363. A good name. Okay. So, okay then. So, can you see Dr. Rachana who joined in that? I could not see. Okay, Rekha madam is there now. Okay, so
Yes, ma'am.
sometimes, yes. Thank you, madam. So we are going into the case 6 now. This is a new case also. So we will give chance to Dr. Rekha madam. Okay. So because she is a very new person, madam, I am discussing about a case. You need to tell me the answer. Okay. So it is a case of pain in the left hypochondrium, and even Dr. Naeem madam has joined. Both of you need to answer for this case now. No other doctor will open his mic or give something in the chats now. Okay. So Dr. Rekha madam and Dr. Naeem madam is going to answer, are going to answer this question now. So in 2019, I had a case of pain left hypochondrium in a 35-year-old female, constantly prolonged by the gynec, saying it could be an ovarian cyst. But sometimes the diagnostic labs also should be perfect, because after 5 months of prolonged painful episodes like that, she came to me with very acute pain leading to depression, and she is accompanied by her husband. So what did she told me? So she is uh, complaining about her husband in his presence only. She says that you are the person who made me to land in this situation now, because you are not caring, you are not taking care of me. I am loving you, and you are not at least trying to reciprocate my love. These are the words she has spoken to her husband in my presence in the clinic. So this much, the case ended there. What would be your understanding or the remedy? Dr. Rekha and Dr. Naeem will be answering now. Yes, madam. So shall I explain one more time? The patient is telling that because the patient is complaining her husband or screaming at her husband that you are the person who made me to stand in this stage
Yes.
now.
Yes.
Yes,
Yeah.
Dr. Naeem, please.
My understanding is it is like unreciprocated, uh,
Love.
unrequited love.
Yes,
So
unrequited love.
what
Yes,
she is
right, madam.
expecting, that is not coming back to her.
Yes,
And also,
So,
so I think that's why she is blaming him.
yes,
So
that's there. That is
yeah.
what I explained. So, what is your
Mm.
understanding?
So I will think of. I usually go by physical general. So left side ovarian pain means most probably ammonium group, ammonium more specifically, because they have that. They blame everything on others. That nature also is in ammonium more.
But she is
And
not blaming everybody, madam. She is blaming only her husband.
husband, yeah.
And the
So,
muriatic part
no,
is
not.
very correct. Hmm.
Yeah, okay.
But that cation is not correct. Just try one more time.
Oh, okay, okay.
Okay, Dr. Naeem, madam, you can try. So she
Hello,
says that.
hello, madam.
Yes,
Good
yes.
evening.
Good evening, good evening. Naeem, madam, please
Sorry for
let me know.
late joining, ma'am.
No, no problem, no problem. Please continue.
Yeah.
Yes, yes, please continue. Please let me know what it would be the remedy or what is your understanding here.
Mm. It could be Kali Moor as well, because Kali Moors are usually very much taken care of, and that type of people. They are like pampered people, and yeah, Muraticum and depression and also those things, because pain leading to depression. So that's why I'm thinking of Calimore
Oh,
or
this
in
is
that way.
Rekha madam speaking. Okay, okay.
Yeah,
So
yeah.
earlier
Yes,
I've been confused.
Naima got it
So
started.
yeah, okay. Naima said that it is ammonia moor, ammonia family.
Both the times I only told.
Oh, you
First
only said,
also.
na? Yes, yes.
Yeah, Naima
The muriatic,
asked to start.
yes, yes. Muriaticum part is right, madam. But what about the cation? So it's very simple, madam. Why I'm selected both of you? Because you are in there in my sessions, na? That is why. So actually, I will let you know one more time the symptom that she told that you have not taken care of me. You need to at least you need to reciprocate my love. At least you need to see. I would have not gone into the stage if you have shown little concern to me. It is your duty, right, to return my love. To return my love. At least reciprocate to my love. Who will be begging like this for love? I have given painkillers like Magfos and Colocin, followed by
Yes, yes.
constitutional natrum muriaticum. So this is a
I
very
thought
simple.
I should not tell Natramur. That's why I was going around other remedies now.
Why you should not tell natrum? Because it is a
Somehow
simple
I
remedy.
felt no,
Yes, yes, yes.
yeah, yeah. That's what I was
Yes,
thinking
yes.
in too much of this thing.
Yeah, yeah. Too
Okay,
much
okay.
depth. Too much depth.
Yeah,
Sometimes the remedies will be very simple. Okay.
correct, correct.
So first, but I have not ventured with natrimur during the pain. First, I have given Magfos and Colocin. And then I have followed by natrimur 1M because I thought there is a constitutional remedy and it won't act upon the pain. That was my understanding at that time. But what I have, and they went to, I think they went to Dubai after that. So I have given painkillers, Magfos, Colocin, followed by constitutional natrimur 1M, and learned that after some time, her husband called. After natrimur only, she became silent, not nagging, understanding. Husband was very happy and went to scan after 6 months, only to reveal normal ovaries and uterus. Earlier, what she is having, I did not tell you about the diagnosis because it's a misdiagnosed case like ovarian cyst, but it is a chocolate cyst of left ovary. Okay, it's a chocolate cyst of left ovary. That is why she is having that much of continuous pain, constant pain, unbearable pain. Okay, so and in that endometriosis case, chocolate cyst is nothing but endometriosis, right? Misplaced, na? Misplaced rubric will be there. I've already told you the conflict of misplaced. So she gave love and that love is not coming back. That is, love is misplaced there. So that is what, because the misplacing thing is love here. So we have gone into row 3 and as such natrum muriaticum is selected. Okay. So after 6 months they went to the scan because there in Dubai there is no facility for them to go for scan every time. So only to reveal normal ovaries and uterus. For the first time in past 1 year they have seen, now only not 1 year, not 2 to 3 years time. Of course they have seen me after 5 months of painkillers and everything, but before that only they are having this complaint. Okay, only to reveal normal ovaries and uterus. And also the icing of the cake is, and also she conceived for the third time and delivered a very healthy child. So this is one addition symptom for us. Bonus. Okay. I still remember her husband saying that the third pregnancy was very happy one, peaceful one, when compared to the anxious and irritating previous ones. This is the point we need to know, that natrum muriaticum is helping, only was helped her, like, okay, because that is her constitution. Earlier she has not received anything, and her two pregnancies went like that, anxious and irritating to other people, not herself and other people. And she has been maybe after those pregnancies she may have received adenomyosis, and after one of those such issues she may have gone into endometriosis or chocolate cyst. So that will be going continuously, because they stay abroad, they are not into continuous diagnostic tests like that. So here what happened, we have dealt with left-sided chocolate, and we are very good in treating that, and we have completely cured that one. Cured, and she has already conceived even after that, okay, with healthy pregnancy. So this is about left-sided chocolate cyst. Any doubts in that case number 6? Shall we go to case number 7? Please let me know. So,
Ma'am,
yes,
ma'am, I have doubt, ma'am.
yeah,
Ma'am,
yes,
is
yes,
it
please.
the polarity of natramune? Because we usually say they are bottled up emotions. Means even though they expect, they don't express what they need. So here she was expressing that she
No,
wanted
don't
the same
express in the
reciprocation.
sense when grief
Yes, ma'am.
is complete in the at most psychotic nature, they won't
Yes, ma'am.
express. But whatever few lines they will express, that will be
Yes,
like
ma'am.
this only. That
Okay.
will be like this only, complaining. Natramur
Okay.
definitely will complain. Ignatia will
Okay,
stay
ma'am.
silent, but Natramur will
Yeah,
complain. And again,
it
Sepia
will
will
happen.
stay indifferent. Ignatia will stay
Indifferent.
silent.
Yeah,
Sepia will stay
yeah,
indifferent, not silent, indifferent.
different. Yeah,
Natramur
ma'am. Got it.
continuously argues. Argument
It
is the
argues.
thing of natrum.
Yeah.
Okay. So whenever you see
Okay.
argument, you can think of natrum in third one.
Okay.
Okay. So shall
Okay.
we continue?
Yes,
So in
ma'am.
case
Sure.
number
Thank you,
7,
ma'am.
yeah, thank you. In case number 7, a dignified lady, 44 years, unmarried, virgin. So I know this girl, this lady very much since so long time, because all of this family is are my patients. So her father retired as SBI director, State Bank of India. Mother is an IAS, and she is a classmate of our governor, Dr. Rangarajan. So Dr. Rangarajan will be visiting his their house. Why I am telling, we need to know the background also. Their house regularly. That means that is why she will be she has her lifestyle will be changed with that, right? So she a dignified lady, but here the patient is that IAS daughter. So that SBI manager's daughter is our patient. She is also 44 years, but she is unmarried. Because of some reason, she is not able to marry, because she is highly, more qualifications are there for her. So they are becoming Sri Vaishnavas. They can't find a boy suitable for her. She stayed unmarried, virgin, having a big position in Government of India. She is also serving for Government of India in the revenue or IFS service, a very big position. Revenue or IFS, I don't remember. So she came with acute right hypochondrium pain, literally crying. So why did I mention all this, her background? Because she wants to stay dignified, but she is literally crying. So how much dignified background she has, that for that purpose, I have explained her family background. Okay. So right hypochondrium pain is there, and she came literally crying. When I meant literally crying, tears are flowing from her eyes. I could not help her much for 2 to 3 weeks. I pata nahi kyun, I have tried different remedies. I thought sometimes system approach, sometimes symptomatic approach. I don't know why. So sometimes we will be not that much sure shot, right? So I have failed in that case in the first 2 3 weeks. But they continued with me despite all others' comments. So it's a very, very large family, joint family. What they will say? Arey, why are you taking homeopathy? Go for the painkillers now. Go for the allopathy. Why are you taking homeopathy? You have already spent 2 to 3 weeks time, and that is the pain, like acute pain. So she's not able to sit, and her all her programs have been cancelled or rescheduled. So I'm also feeling guilty on my part. So I thought that I need to attach her to another homeopath. But they continued with me despite all others' comments, because already many such chronic cases in their family were successfully treated by me. That is their belief and trust upon me. So I was anxious and wanted to send to another homeopath, because allopathy medicine did not prove much with her. She has already tried allopathy and came to me. Okay, by this time you could guess that it is an endometriotic pain, right? But she insisted to stay with me, and suddenly, what is the thing I got? What is the one fine day she said that, madam, you can do, madam, I know that you can do. Please take care, please take my case seriously. I won't go away from you, so I have trust upon you, and you will be able to treat me. That is what her lines for me. And suddenly one day she came and she sat in anorectal position. She has taken away the chair in the clinic. She has kept away the sofas aside, and she suddenly sat on the floor. Such a dignified lady, she suddenly sat on the floor in malasan. Malasan in the sense, in the Indian pose of passing stool, the anorectal posture. And she said that this is the position, this is the only position where I can get amelioration of the pain, not with bending double, not with heart massage. This is the only position I am getting amelioration to the pain. And when I am standing, the pain is radiating to the right thigh. Only these two symptoms I can get after 2 weeks, not before that. Okay. So then, any guess? First, what is the symptom or what is the approach I will be going in this? And what would be the diagnosis? Why she is having that much of pain? In that 2 to 3 weeks also, she did not went to the any scan because of the pain. Okay. So what would be the remedy? Any guess? So at least you let me know about the approach. Which approach I will be using here? Symptom or system? Make it fast. You can chat.
Symptom.
Symptom approach.
Yes. Then what is the remedy? By symptom means you are already know that it is a PQRS, right? So what is the remedy? This is the remedy. What is that? Simsifuga 200. By that radiating to right thigh, I could get that immediately. Simsifuga 200 amelioration in anorectal position, which cured her right-sided chocolate cyst in the ovary. How could I know that is chocolate cyst? Simsifuga has alleviated her pain, and immediately they went to the scan, and it revealed a right-sided very big chocolate cyst. Complete ovary has been covered with endometriotic cyst, endometrioma, are called as chocolate cyst. And then after Simsifuga 200, she got her pain decreased, and Simsifuga only has been given to her in multiple doses. Over a period of 1 month to 2 months. I think some 11 doses are more than that I have given for. We've given her for her in a span of 2 months. Then after that, the scan became completely normal. To my utter surprise, also astonishment. Till date, she did not complain of any pain or any other symptoms. That is what is more important. She is having general allergies, nasal allergies, headaches, migraines, because she is a workaholic, completely works like anything. So that is why all these complaints are there. But till date, this happened, I think some 3 years or 4 years. I have given the date, right? So came to me, okay, that would be 4 years back, 4 years or 5 years back. Okay. So till date, she did not receive any medicine after Simsifuga. So that is called symptomatic PQRS approach, where I got almost cured the patient. Why did I mention almost? Because we would not mention that as cure. We are not, we don't have a right to mention like that. So I said that it's almost cured, in the sense it is cured. Okay. That is what is the seventh case. That is about chocolate cyst in the right ovary. The earlier case is chocolate cyst in the left ovary. These two cases are of endometriosis. All of other the cases are adenomyosis. So can you see the change in the symptoms relief only? Endometriosis case, they will come with very acute pain. pain like any pelvic sharp reasons, that the pain we can't understand such pain, and the pain would be the pain would be outside the menstrual cycle also. The pain would necessarily not be during menses only. It may come before and after the periods also. After the periods also. Immediately, if the patient says she is having pain after the periods and she is having pain while passing stools and urination during menses, then you can think of endometriosis. Okay, it may be adhesion symptoms also. Okay, so now what? Before saying thank you, I will give you one case. Do you like to solve that one? Because I did not type that case here. So I will give you one case, and that is perfectly, I am telling you the clue also, that is perfectly on kingdom approach. And those who are studying with me have completely finished that remedy also. So we will see whether you will recollect that remedy or not. Okay. So this is the case. Just this is the last case. So be with me for 10 minutes. So this is the case. I will explain. I will explain only one time. So go, be alert. Please be alert. So one lady of age about 28 years or 29 years, she is a very mild lady and she is a software professional. She works at Hyderabad. She, along with her younger brother, came to me one day with the reference of my sister-in-law, and they have come for their father who is suffering with end-stage carcinoma brain cancer, and it is also in 4th stage. Okay, it is not responding to any other treatments, chemo or radiation. No. So for the palliative process, they have come to me, and I have even told them that I can give only palliation. Maybe the pain will be alleviated. That's all. So I am also aiming to have palliation in that case, but they have expected more from me because within the first 15 days, the pain has reduced to 90%. 90%. They have not at all seen that result with any other allopathic medicine. That was another case. We will discuss that case some other time. So with that instant, they have expected more and more, that they being some lay people, they thought that maybe they can have some more time with their father, like some 4 years or 5 years like that they are expecting. But one fine morning, he passed away. So that has been a shock, especially upon this lady. More than the brother, this lady has taken this as very shock. Okay, shocked. And she has absconded. She did not come to me again. So making me guilty. She did not come to me again, making me guilty. I thought that, okay, I have told that case is like that. Why would I feel guilty? So I have already told them that it is a palliative treatment, and I have tried my best and I have shown the results also. Then why would I feel guilty like that? But she did not return to me till 1 year or 2 years. And one fine day, after she is having 30 years age, she again came to me, called me, whether I am available or not. So now she and her husband are patients now. I said that, okay, you may be having a kid right now. So because you are married so long, 4 years or 5 years away. So she said that, no, madam, I don't have kids. We are having good marital life. I don't have kids. So then what's the problem? But the problem is she has taken her father's death upon her very much, wherein and she is having multiple complaints now: fibromyalgia, pain here, pain there, acidity, indigestion, insomnia, anxiety, depression, and she left her job. She is not pleasant at home also, and causing her husband also some type of anxiety issues, and he also ended into acidity, indigestion because of the anxiety. He is into grade 2 or grade 3 hepatomegaly also, fatty liver also. Okay, like that. So this is what is the situation when they came to me again upon the advice of my sister-in-law only. My sister-in-law has counseled her, and she made to see me again. And then she's explaining all these symptoms. I have asked her about her father's death. Why did she has taken so long time, fearing that she may be bombarding me, because that is my constitution actually. So, but she told that, madam, I have taken that to my mind. So I said that, why did you take that to your mind? Your father is already suffering since 2 to 3 years time. It's not a sudden thing. You all have been adjusted with that now. You know that one fine day he will be passing away. And as far as whenever you come to me, I have tried my best and I have made the pain 90% decrease, and he passed with in a painless way only. That means you need to thank me, or you need to feel good about your father's demise now, right? But why did you take that on your? So what is actually going on with you? This is my asking to her. What she explained, Now go through these lines, okay? She said that, Madam, I am so good with my father. I am so attached to my father. I am my father's little princess, my dad's little princess, something like that. She is telling. She is about 30 years now. So she told like that. Then anybody, every lady will be like that. Every girl will be attached to the father. I thought that much. Her DP till date also is there, attached, hugging her father. DP only is still there in her display messages also. So we need to see the display picture very, very good. Oh, whatever their mind will be, that would be shown on the display picture. So that is also one clue for us. So till date, her display picture has not been changed. She is hugging her father after marriage, and that picture is displayed in her WhatsApp display picture. Okay. So she told that. So okay, what is that? Why are you so attracted to your father like that? Why are you so dependent upon? I am so dependent upon him, madam. I feel so secure with him. Security. Okay. What do you mean by security? So I feel like this, the gestures. Okay. Go through the gestures. I feel like I'm secure with him. I feel like I'm secure with him. Secure with him. So I just asked her, please explain this gesture. So she said that like a balloon, like a balloon, or like a womb, like a fetus in a womb. That much secure I am with my father. My father's death has, I am feeling that my cover has been blown away. My cover has been blown away, and I am exposed to the deadliest world now, which I can't face at all. So I am a dead person. So that is why I've gone into the house and I'm not coming out. I stopped working, I stopped eating, I stopped sleeping. And this stage has gone for 2 years. Please remember, 2 years. She has not, she may be taking some psychological remedies, but not that much. And she did not reveal about that. Okay, so this is what is her stage now. Okay, immediately I got one remedy. I wanted to keep that remedy for her as a constitutional remedy. So I said that. So what about children? Are you planning? Madam, I am like this, madam. I can't take care of the children. So I don't want to go for children now. Why are you do you don't like children or what? No, madam, I like children. But my intention is, if I would become a mother, I need to take care of my children like this. I need to protect my children. Again, like this. I need to protect my children. So when I am in that stage, I'll go for pregnancy, otherwise no. So I said that you are already 30. It would be very difficult to get conceived at this age. You are already married since 4-5 years. So first I will decrease your depression with homeopathic medicines, no problem. You plan for the fertility treatment, infertility treatment. Infertility treatment is little more costlier with me, so I'm focusing them on that infertility treatment, because they are infertile couple, because they are been married since 5 years. So I have made that husband also go for semen analysis, and I have made her also to go for all the hormonal profile after the remedy, not on the first one. First I have given the remedy, and she is much better after the remedy. And she said that she has already taken some life coaching. She has already registered herself with a life coach, with a mentoring life. That is also one point for us after our remedy. And now she is happy. Her acidity decreased. At the same time, her husband issues also have decreased. He received some other set of symptoms. He received some other set of medicines. That is different. And that is another case. We will discuss that afterwards. But regarding this lady, she is having, her scan has already shown adenomyosis. No, not adenomyosis. What would her scan will show? Can anyone tell me? We are speaking about adenomyosis and endometriosis. What would her scan will show? This is her conflict. So what would it show? Endomyosis or metriosis or adenomyosis? This is her conflict. Okay, I have explained about her conflict, her stress level. What can we expect in her scan abdomen? Uterus scan में क्या आ सकता है? Adenomyosis or endometriosis? Only answer in these two. Adenomyosis आ सकता है or endometriosis आ सकता है? What is that? We have already discussed the conflicts, right?
Endometriosis.
Why?
Because uterus is a nest family, yeah, the conflict between the family.
Adenomyosis also same family, same conflict only. So Naeem madam, you said about adenomyosis. 1 second, I will. So it is adenomyosis. It's not endometriosis because she is not going into destructive mode. She is still in psychotic or psychosyphilitic. Okay. So that is why her scan has shown adenomyosis, and that is why we are discussing this case here now. Okay. So extensive adenomyosis, because since 2 years she is suffering. I said that adenomyosis is also there in uterus. She is not worried, you know. She, after the first remedy I have given, she is not worried. She says that adenomyosis has to come down, and you need to have some infertility course now, some 3 months medicine or 6 months medicine for both of you. Then you will be able to conceive. But she did not want to take the infertility medicine at all. Infertility medicine in the sense, what I mean to say, give her is estrogen, progesterone, and the blah 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 like that. The intercurrent of after the chronic constitutional remedy. I thought that it would be necessary. So after this remedy, she did not receive any one, and she received the higher potency of the same remedy after 6 months. And she does not want to take any infertility medicine. She said that, madam, if you give any medicines, I feel that my cover is blown again. I don't want to have child with medicines. I want to have everything natural. I said that it is natural only. I did not not able to convince her. Okay, that is what is the fear level of her. So yes, what is the remedy? I think you have already got the remedy now. 2-3 days back you have learnt about this case. సునీత కొంచెం ఇంకా రిఫైన్ చేసుకోవాలి మీరు, కొంచెం ముందుకెళ్ళండి. అండ్ ఐ హ్యావ్ ఆల్రెడీ టోల్డ్ యూ దిస్ కేస్ ఇన్ ద సేమ్ లైన్, సేమ్ వర్డ్స్. ఎస్ 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 ఎస్, యు ఆర్ రైట్, బట్ లెట్ మీ నో యువర్ ఎక్స్ప్లెనేషన్. డాక్టర్ సునీత దేవర్ is explaining that it is lithium. How is it lithium, madam? Any other inputs? Let me see in any other inputs.
Ma'am, she's still in the fetus stage, and she feels secure when she's covered and in the womb. When she's
Very
protected, when she's
Yes.
protected by her father, and
Yes, very much,
and she
very much.
feels
All the
unsafe.
words, yes, all the words I have told you in this same language, right? In our last
Yes, ma'am.
session,
Yes,
just
ma'am.
before 2 days.
Yes,
So you may
yes,
have spotted that very good. So what happened to all the others? So now I have an idea that I need to take much more time for revision in our classes, not to go through. Okay, okay then. So this is a case of lithium carb. Why carb? Because she is very lazy, inside only. She is not eating, not sleeping, not cooking, nothing. She is doing anything. So, and also she is a little chilly patient. So I have added carbonicum to lithium and made lithium carbonicum and have given lithium carb 200. Because it is a rare remedy, I have given only single dose. And I'm checking upon her. She's becoming a little bit better. I asked her to take one more dose next week. Little better. Third week, one more dose I have given. And after third week, after the end of 1 month, she is completely good. Her sleep has been good by 50%. Her depression decreased. She is able to eat something. Her acidity decreased. And she is becoming normal. She can also recognize that she is becoming normal, and she became happy. And after the end of 3 months, she is completely normal. Her adenomyosis has decreased to 80% decreased, only 20% is there seen again. So again, I have given After 3 months, I have given 3 more doses like this only, weekly 1 dose. And after that, I have not repeated. So after 6 months, and after 3 months, I have asked her to take infertility medicine. She denied. And after 6 months, she said, I thought that 30 years हो गई, husband को semen count नहीं है इतना ज़्यादा, and AMH is decreased. Better remember, AMH is very low with her. Okay, all these days we are worrying about AMH, right? So AMH is very low in this case, and all other infertility features are there. Everything is unfavorable. But here, only one remedy, lithium carb, has improved her state of well-being, and her inner state has been cured. And all immediately after 6 months, she conceived. She kept a message that she conceived. To my utter surprise, I thought of only cleaning of her depression. I never expected of having conception in this case. Really, I never expected, because I am thinking of giving her so much of medicine. I am thinking that after 6 months she will come again to me and she will say that, Madam, please give me infertility medicine. I am not able to conceive. That was my idea. But to my surprise, she has conceived. And this May 26th of May, she delivered a healthy girl baby. That is also normal delivery. No issues all through the pregnancy. That is what is the noting point. No issues all through the pregnancy. And she delivered a healthy girl baby, normal delivery. And both mother and child are very happy now. Lactation is also perfect. For that 30 years lady, where AMH is less, where progesterone is high, prolactin is also at the borderline. Okay. So this is what is the power of constitutional remedies, and where we can get very easily with the kingdom approaches. Okay. So how much time it has taken for me? At least within half an hour, I can solve this case. Right. So this much of case. Otherwise, if it is in symptom approach, so we will be taking all the reports. We will be writing all the report. Even now also I have written the reports. That's a different point. But we will be applying rubrics. We will be applying this and that, and we will be evaluating the symptoms. Which symptom to be taken more, which symptom less, like that. And we will be doing all the exercise, and naturally we are stressed. Right. So in this, like this, I have not left that symptom, like that gesture swally symptom. If at all I don't know symptomatic is that system approach, I would have left that symptom comfortably, right? I would have taken that it is a depression, insecurity, depression due to insecurity. That's all. That insecurity is not been explained. That gestures are not been explained. I would have left that. If at all I don't know this approach. So we should continuously updating our knowledge. We should be continuously updating our knowledge in homeopathy. Continuously. If somebody says that I have given 50 m potency for continuously 15 days, every day 1 dose. Such prescriptions are also there in homeopathy. At the first time, I thought that this is bullshit. This is my first expression. This is bullshit. Becoming such a very big doctor, how can he prescribe that? But after learning, going through the kingdom's approach, I thought that anything may be possible in homeopathy. I should only learn how is this possible, and what is the background which is helping like this, and what is the idea of that potency. Like that, my learning should be going on like that. Even the PQRS method, everything is possible in homeopathy. Okay. So just we need to keep updating our learning. That is why this is my last slide. जैसे भी आपको पता है, श्रद्धावान लभते ज्ञानम तत्पर संयतेन्द्रियः ज्ञानम लब्ध्वा पराम शांतिम अचिरेणाधि गच्छति. One who is faithful, who is dedicated to spiritual knowledge or knowledge, and who has control of the senses, achieves knowledge. And quickly after achieving knowledge, we can attain supreme peace. That means we need to be having control upon our senses, and we need to be very hardworking every day to get the knowledge. Okay? Because knowledge is not free. You have to pay attention. Okay? And this is Thank you. I think I have finished this in 1 hour 10 minutes. This is my earliest. This is my fastest session. I think
Fastest,
Dr.
yes, but this was the part two, ma'am. So we are
Part two.
continuing with the first part.
Yes, yes.
So you
But even though
cannot
I
say
have
this was the,
added, yes, yes. Even
yes,
though I have
this was an
added,
add-on
I have
session.
added. If at all Alka is there, means she would be very happy person. I miss her today
Yes,
because she is my timer actually. I would generally
yes,
say Alka has my timer in my sessions. Okay, okay. We'll let her know that the session is ended very fastly today. So 1 hour 10 minutes. So any doubts? I'm open for another 10 minutes. It doesn't. So if at all you have any doubts, you can unmute and ask me directly. No need to write in the chat so that I'll be seeing and asking again. So anyone can ask
Any
any doubts
doubts, please ask.
about this topic or any other topic. You let me know so that we can prepare for that topic next time in our platform, Iconic. Okay.
Yes.
Any other suggestions you want to prepare for the next sessions? Okay. You can give that in the group. Okay.
In the group.
Thank you,
Yes.
dear friends. So now it's all you.
Thank you so much,
To you.
ma'am. We got to learn
Yes.
so much from you, and amazing cases you had. And the last case was also very interesting without the slide. So thank you again with all your cases and all your approach.
Thank you very much.
Somebody is writing something.
Yes, please. Let me know.
Ma'am, this is the first time, but I'm speechless about such sharing.
Oh,
so
Neha Sharma.
Neha Sharma, yes.
Yes, Dr. Neha,
So
thank you
thank
for
you so
that.
much, ma'am.
You can join with
And
me,
we
Dr.
hope
Neha, to have that continuous, such type of studies to have continuously. Okay. And Dr. Rekha,
and
madam, you have said,
we
one
hope
second,
with,
Rekha. Birth canal don't want to come out cozy there. Birth canal, it's not, madam, it's not birth canal. Birth canal is nitrogen, na? Birth canal, nobody will be cozy, madam. Birth canal में से तो बाहर आना ही पड़ता है. Nobody can stay in that canal. They'll be staying in the womb. They'll be staying in the womb before 9 months. Okay. Okay, Dr. Neha. So I will, you are in Iconic group, right? After this session, I will keep the link, link in the Iconic group so that you can check and you can join. Okay. Okay. Yes, Dr. Rachana, to you.
yes, ma'am. So we hope to have another session of any topic in gynecological cases only, so that we learn. And whenever you are free, we can do that.
Yes, the what we call the symptom which is running close to these two is uterine fibroids, right? So we will deal with uterine fibroids in the next session whenever we have time. Okay. Okay.
Yes.
Then.
Okay, ma'am. Okay. Thank you so much, ma'am, for your insights and for your knowledge. Thank you so much. And thank you
Thank you,
everyone
ma'am.
for
Thank you
joining.
so much.
Thank you.
Yeah,
Thank you.
thank you.
Thank you, Rachana, and thank you, Iconic.
Thank you so much, ma'am.
So, thank you. Thank you. So, shall I disconnect now the call?
Yes, ma'am.
Yes,
Thank you,
ma'am.
ma'am.
Yes.
Thank you. Good night.
Night. Thank you.